Hey, this is Chris Welsh, board certified OBGYN with Women's Health Media. I'm at the Hilton Point Tapatio Cliffs Resort in Phoenix, Arizona at a meeting. And I thought we could talk quickly today about ovarian cysts. So remember that this video is not intended as personalized medical advice. It's just a starting point for you and your doctor to discuss the most current information and the circumstances specific to your clinical situation. So don't forget to have that discussion. So first of all, what is an ovarian cyst? An ovarian cyst is a growth on the ovary that can be filled with fluid or filled with solid material. Something that's very important to understand is that sometimes doctors will use the word tumor. Tumor does not mean cancerous, so don't let that frighten you. Make sure you talk to your healthcare provider about what exactly he or she means with the word tumor. Secondly, ovarian cysts are very, very common. It's estimated that 15 to 20% of women will get an ovarian cyst over their lifetime. So it's something that impacts quite a few people. How about types of ovarian cysts? Well, ovarian cysts can be categorized by how they appear on imaging study, and we'll talk about imaging studies a little bit later. But ovarian cysts can be simple, just a thin fluid-filled sac. Those are more commonly associated with younger women. Probably 50 to 70% of them go away on their own. They're commonly associated with ovulation or lack of ovulation. So that's something to pay attention to. Some ovarian cysts can be septated. That's a thin wall, usually 2 or 3 millimeters. They're commonly seen with certain types of ovarian cysts, and if the wall is thin, they're very often benign. There are cysts with papillary projections, thickened portions of tissue that then stick out into the cyst, and those are ones that have to be watched. And then there are ones that are solid. And cysts that are a combination of cystic or solid, that have papillary projections, that are solid in and of themselves, those are the ones we have to be more careful about, because a percentage of those, up to 70 to 90%, can be associated with cancerous changes, and we'll talk about that a little bit later as well. Different types of cysts are things like a functional cyst. I mentioned earlier just a simple thin-walled cyst in relation to ovulation. Those are simple, they're smooth, and probably the majority of them go away over about 6 to 8 weeks. There's something called a mature cystic teratoma or a dermoid cyst. That's a cyst that's more common in young women as well, mostly in the 20 to 40-year-old age range. These are interesting because they have tissues in them from other parts of the body like bone and hair and teeth and fat. They're very, very unique and most often benign. There are cysts called cystadenomas, which are cysts that develop from the outer covering of the ovary, and those are most often benign. They can get very, very large, but rarely they're cancerous. You may hear the word endometrioma. That's a type of cyst that's related to endometriosis, a very specific type. And then there are cysts related to severe pelvic infections. Commonly, women can get cysts in pregnancy. Then there are cysts that are cancerous cysts. Many different types of those. We'll talk more about that a little bit later. So what are the symptoms of an ovarian cyst? Well, most of them are asymptomatic. People don't have any symptoms at all. But if women do have symptoms, they can be pain or pressure. Sometimes they can be found on pelvic exam or on abdominal exam and manifest as a fullness or a mass that can be felt on examination. Cysts can be diagnosed many, many different ways. I mentioned they can be diagnosed by physical exam, but the majority of time they're diagnosed by imaging study. There are 3 main types of imaging studies. One, an ultrasound, one, a CAT scan or computerized tomography scan, which is an X-ray, and another, an MRI or magnetic resonance imaging. Those use magnetic waves to generate images inside the body, and those are the most common ways to actually evaluate the character and size of an ovarian cyst that may have been detected on exam or may not have been symptomatic at all. So what are some of the dangers of ovarian cysts? Well, one of the dangers is that the cyst will rupture. That can cause a lot of pain that happens very, very suddenly. Generally, those are things that the fluid from an ovarian cyst absorbs on its own over the course of a couple days, but some cysts can bleed. And those bleeding cysts can be surgical emergencies. So make sure if you have severe or sudden pain that you contact your healthcare provider right away. Ovarian torsion is one of the things that can happen with a cyst. Torsion is when the ovary actually twists on itself and cuts off the blood supply to the cyst and causes the cyst and ovary to start to die. That's the 5th most common gynecologic emergency, and about 1/3 of this happens in women under the age of 20. The symptoms are pretty classic. They're severe abdominal pain, oftentimes associated with nausea and vomiting. Sometimes in younger patients, they can be manifested as a fever or restlessness Thankfully, when this occurs, less than 4% of the time is it ever associated with an actual ovarian cancer. So ovarian cancer is something that scares everybody, and appropriately so. It's generally something picked up very late and can be a devastating disease. But let's talk a little bit about that. So what makes a cyst suspicious for ovarian cancer? Well, one of the things is how it looks on ultrasound. If it has, as I mentioned previously, complex or thickened walls or irregular appearance, things other than a functional cyst, that can be concerning. When an ultrasound or CAT scan or MRI is done, if fluid is seen in the pelvis, that's something called ascites, and that's concerning. Blood flow in the cyst can be measured, and certain patterns of blood flow are more commonly associated with ovarian cancers. And there's also blood tests you may have heard about that can be associated with ovarian cancers. One is called a CA-125, or cancer antigen 125. This is a protein that's produced by different tissue types. The hard thing about that is a number of ovarian cancers don't actually produce this protein, and it can be elevated in other conditions like fibroid tumors or endometriosis or certain bowel or liver disorders. It's a test that can be done in people before menopause, but it's probably a little bit better in people after menopause. There's also a test called the OVA1, which is a measurement of 5 different proteins, and this can be elevated in up to 75 to 99% of certain ovarian cancer types. This is one that's probably better for patients who are younger or before menopause. There's a third one called the HE4, or human epididymis protein 4. That's something that I've read about but really haven't seen very commonly drawn, but something that can be a marker for certain ovarian cancers. There's also ways to look at the texture, what's called the morphology of the cyst on the ovary, and there's something called a morphology index that can be measured one time or over time to show or to increase or decrease the suspicion that a cyst is cancerous. And then there's other risk factors like age. Only 4% of women under the age of 30 with a cyst will have a cancer, but up to 50% of women over the age of 60 with a cyst will have a cancer. So it's certainly related to age. And then family history is another component that's important to take into account. There's something called a BRCA, or breast and ovarian cancer gene mutation. This can increase someone's risk of ovarian cancer significantly. Also another disorder called Lynch syndrome. There are also rare types of things that can be potential complications of ovarian cysts, such as Meigs syndrome, which we can discuss at another date. But there's a couple of different ways to treat cysts. One is just watchful waiting. And if your healthcare provider recommends just watching and waiting, it's very important that you follow his or her advice on when to come back, how frequently to come back. He or she may order repetitive ultrasounds or blood tests to watch to see if the cyst has a greater or lesser likelihood of cancer. Another option for the treatment of cyst is surgery, and this may be recommended due to the finding of certain features that are worrisome for cancer, due to symptoms the patient may be having, due to the size of the cyst, or due to results of the laboratory testing that we talked about earlier. If surgery is recommended, there's a couple different options of surgery. One is minimally invasive surgery or laparoscopy, where the doctor does the surgery through small incisions in the abdominal wall. The other is traditional surgery through an incision in the abdomen that can take longer to recover from, and patients oftentimes will stay in the hospital with a surgery like that. The different types of surgery for ovarian cysts would be things like a cystectomy, or actual removal of the cyst itself, but the ovary remains, or what's called an oophorectomy, where the whole ovary has to come out as one block. And that would be a decision that you would make in conjunction with your healthcare provider as you discuss the different findings of the cyst and the things that you all were concerned about. So this is just a basic overview of ovarian cysts. Remember that your healthcare provider is the best source for information for questions and concerns regarding your specific medical condition. So make sure to have that conversation with him or her. Thanks so much for joining me today. Look forward to talking to you again soon.